So today we will be talking about automated periodontal probing and charting. To begin with, we'll talk about the famous brand Florida probe, which comes with two different types, which is the Dolphin probe and the VoiceWorks probe, as well as another brand that has created a automated probing slash charting probe, which is the PA on probe. To begin with, we're going to talk about the Florida probe, which probes, charts, educate, and motivates clients as well as clinicians. To begin with it, what is it? It is used to capture periodontal disease in its earliest stage and assess periodontal risk screening tool, calculating patients' risk of periodontal infection or reinfection based upon specific risk factors, including smoking habits, age, oral hygiene, medications, and assign patient a low, medium, or high risk score based on their probing, as well as the ability to print, email, or digitally store the periodontal chart and printouts for electronic insurance claims, referral doctors, and patient use. To begin with, we're going to be talking about the Dolphin probe. And this probe is a single-use, disposable, and constant force probe. So you can measure periodontal pockets more accurately and as fast as a two-person team with these constant force automated probes. By bringing the gold sleeve of the handpiece down to the gingival margin and tapping the foot switch, and your numerical data is recorded with no guessing and no assistance needed to write down numbers. So these three steps are all you need to use the Dolphin probe. So in the first step, as you can see in the picture, you will be using the same angulation and position as you would with a manual probe. You just need to place the tip of the Dolphin disposable between the teeth and gums. Angle the tip down so that it slides down the tooth at the root angle. And as for step 2, the clinician must then properly position the yellow sleeve at the top of the gingival margin. And as for the third step, when you are ready, you will tap the foot switch to stimulously record, display, and call out the measurement. Other indicators of disease can also be recorded. For example, the left side of the pedal marks bleeding and the right side pedal marks suppuration. So therefore, this footstep is what the clinician will be using to record all of the numbers and bleeding points.
So some advantages are automatic charting. So it automatically charts the numbers as you probe. And it also has disposable tips. So each tip is single use and there's less chance of cross contamination. And then we have a treatment map. So by using the results from the periodontal chart, a treatment map for scaling, root planning, and subgingival and microbials or even laser use can be made from the treatment. And then for customizable exams, the exam can be customized to record all or some of the following. So dentition, medical history, risk assessment, recession and hyperplasia, gingival attachment, pocket depths, bleeding, suppuration, furcation, plaque, mobility, and mucogingival junction, and diagnosis. And some disadvantage of having to use the stepping foot switch can be very difficult for focusing on probing. And then it also has some difficulties probing deep pocket depths. So it can often underestimate the deep pocket depth probings because of lack of tactile sensitivity. And then it also requires clinicians to be trained on how to use and operate the probe.
Another very popular Florida probe that has been invented is the VoiceWorks probe. This is a voice-controlled Perio charting that works. So this is a chart. This helps to chart periodontal pockets depths effortlessly while using your manual periodontal probe and speaking into the mic of the wireless headset. It charts bleeding, recession, and separation on the fly. It's very fast and easy, and it allows your patients to hear the human voice of the software repeat the numbers back to you to create a co-diagnosis effect, such as if someone was to read 323, the voice works would repeat the same number back to you. So for the client to also hear the numbers. This helps present your patient with a graphically stunning and easy to understand printed Perio chart at the end of the exam, as well as it only takes 6 to 12 minutes to complete an exam with the voice works. So this is how it works. Here is a video on a representation of it.
Hello, Laser Perio office. My name is Diane Sharp, and I'm with Florida Probe VoiceWorks. First of all, I want to say congratulations on going through the training and bringing cutting-edge technology into your practice to help your patients' periodontal health. Now that you have laser training, I want to make sure that you're utilizing it to the fullest capacity. So I want to talk to you for a second about a tool called Florida Probe VoiceWorks. It's going to be able to do two things for your practice. Number one, it gives you fast, solo, unassisted perio charting. You can pop a headset on. You can pop into a perio chart without having to get up, go around the practice, interrupt a team member, or even worse, try to do the perio chart by yourself. So the convenience factor is certainly one of the reasons to consider looking at that. But more importantly, we've built some things into our software specifically for you, the laser perio office. So imagine if you could pop that headset on, and as you're reading through your pocket depth numbers, if you reach a certain level, we have the capability for the computer to actually say laser or laser recommended.
315. 3 midline. 1 laser recommended. 5.
We find that when the patients are hearing the computer tell them that they need laser treatment, that they jump in and accept that treatment. So happy to do a 15-minute web demo with you, answer any of your questions. Please contact me at the number below. Thanks so much.
So as for the VoiceWorks, many offices can purchase this through a monthly payment or buying it just out of pocket. So for example, with one headset, it's going to be $3,399, which comes to $70.81 per month. There's different types of memberships, and they even have a 30% discount right now for that can be built by Oral Science. So this is something that many offices can take a look at based on financial problems or such things. And these memberships include software license and upgrades, technical support by live chat, phone and email, trainings and unconditional equipment warranty, and unlimited entry of new charts.
So some advantages are it can reduce cross-contamination because it minimizes the contact between the clinician and the keyboards and mouse. And then it also has the ability to quickly identify diseases at its early stages and alerts the clinician and even the client about any areas of concern. It has ensured accuracy. The system repeats each measurement to you to make sure that they were inputted correctly, and you have the option to go back and change if it was incorrect. And then there's a risk analysis. So the Florida Probe offers a risk analysis that is custom to the patient's medical history. The clinician inputs the patient's medical history, history of smoking, medications, behavioral habits, and family history in a simplified format and conducive to an effective appointment. The patient is then provided with a comprehensive review of how their medical history is impacting their overall health. And it's also super fast with charting, with the ability to complete a full chart probing in under 6 minutes without the help of any assistance. So one of the disadvantages of this could be the price. So if a clinician decides that they want to be on their own and employ their own clinicians in their own like their own business, it may be a bit pricey based on how many clinicians are working in that place. So if the prices were maybe cheaper, then I think it would be more affordable for a clinician that's wanting to start their own business.
So the last automated probing or charting tool that has been invented is by Orange Dental. This one is the PA on automated probing slash charting machine. You can recognize periodontal disease at early and minimize their risk. The PA on simplifies and standardizes the recording of the periodontal status. The measurement results are immediately visible in the charts and as well as during probing. The the depths of the pocket, attachment loss, and recession are automatically determined and transmitted to the practice management system, as well as the sterile disposable tip is calibrated to applying a standardized force such as 20 grams. This provides precise, standardized, and deligible results, even is very different because many patients usually say that the regular probes may be painful for them, but with the PA on probe, it is less force, and many people say they don't even feel anything. Common measurement procedures can be set through the software, for example, number of measurements, points per tooth, recession, bleeding index, so the practice doesn't have to change it as its usual procedures. Here is a video on how it is used.
Welcome to Orange Dental. More than 50% of all adults will sooner or later suffer from periodontitis. Unfortunately, periodontitis is often recognized too late. I just had the unpleasant experience. In Germany alone, we're talking about 35 million cases. Only 1/3 is in treatment. And I'm sure it's the same thing in your country. Right there is a big potential you can use for your dental practice. How do you do it today? Do you manually probe using an assistant? Do you already use digital tools? Do you fully charge for it? Think about it. Are you really fully tapping into this potential? Our fully automated Perio probe PAON can make your life so much easier. You have to see this. How it works? Of course, fast, simple, and easy. And it makes a lot of sense. Steffi, could you please help me? The measuring tip is extremely thin. The tip disappears into the probe head like a theater knife. The patient experiences almost no pain during the recording. The hygienic disposable measuring tip is calibrated so that it always develops precisely 20 grams of pressure. It is so difficult to always measure with exactly 20 grams using a manual probe. Depending on the dentist or the hygienist, the pressure varies and is often much more than wanted. With PAON, you get standardized measurements results, even in between different dentists or hygienists. That's why you can easily delegate the measurement. You can follow your usual measurement procedure. With 4 or 6 measurement points per tooth, with or without bleeding index, and so on, you can set your personal measurement procedure in the software. Put on the hygienic measuring tip, calibrate it, and ready to go. While you are recording, the probe gives you an optic and acoustic feedback.
2, 2, 4, 5, Monsieur.
You don't need an assistant to document the measuring results because the probe memorizes everything. After measuring, you just put it into the docking station. The data is automatically transmitted to the software. Right away, you see the results on your screen, and you can speak with your patient about it immediately. In addition, it's possible to transfer the data directly to the accounting software. So, what are you waiting for? Periodontal status made easy, a solution by Orange Dental.
So some advantages of PAON is it has less time recording reading points, and it's more efficient. It has display assisted recording, and then data transmission is easy and it happens automatically. And then the design. So the flexible and slender design of the sturdy electronic probe, it has higher reading accuracy compared to the standard manual probe, and it's more equipped to follow and reach the base of the periodontal pocket and follow the curvature of the tooth. It also reduces the pain clients experience during probing compared to that of a rigid tip of a standard manual probe. And then some disadvantages are it has limited probing depth, so it is limited to 11 millimeters, and findings for extremely severe periodontitis presenting with deep vertical pockets cannot be taken due to this limitation. It has limited access to molars. These regions are hard to access due to the size of the probe itself, and because the molars are so far behind in the mouth, there is limited space. Even though the flexibility is an advantage, it can also come as a disadvantage because the tip, because it's so flexible, the clinician may lose orientation and tactile sensitivity when probing the pocket. So it just makes it difficult sometimes to get accurate readings if they lose that tactile sensitivity. And three ways we could improve this product is by the flexibility. So, like I said, also it provides, although it provides accurate readings, if the tip was a bit more firm and sturdier, it would be easier for the clinician. It would be less likely for the clinician to lose that tactile sensitivity when they're below the gums. And if the length of the probe could read up to at least 15 millimeters, it would be beneficial for the clients to, for the clinician, sorry, to get the severe periodontitis if they have pockets above 11 milliliters. And then the design, if the design of the handle was a bit slimmer, it would make it easier for the clinician to.
So some advances in automated periodontal probing, it's precise measurements of periodontal parameters are important for diagnosis of periodontal disease and its treatment. And for most clinicians use manual millimeter scaled probes depend on adequate pressure and correct readouts. And electronic probes aim to objectify and facilitate the diagnostic process. In recent years, a new computer-based electronic and pressure calibrated probe has been introduced to the market. Measurements are taken calculating the insertion depth of a thin steel tip with a plastic cover at 20 grams, 0.2 Newton pressure using resistance. Due to a computer-based measuring sequence, tooth-to-tooth data is recorded on a chip, um, read out loud, and transferred wireless in a computer-based periodontal chart. And there's some interesting facts. Due to technology, automated periodontal probing is able to help save time and no longer will be necessary to pull staff away for assessments. The Florida probe is able to integrate with over 48 practice management software programs, ability to help create a co-diagnosis effect, and they so yes, as the client listens to the verbal warnings and other indicators of disease and also sees these indicators on screen during the exam, and clients view a 1 to 4 minutes um, client education move, then go home with a copy of the information from this move, their exam chart, and a treatment plan to better understand their disease. And the office is with just one hygienist properly utilizing the Florida Probe, Dolphin, VoiceWorks, or Go Probe systems can increase hygiene revenue by 10,000 per month. and training to use the voice work system only takes about 1 hour of live internet web training.
And that's the end of our presentation.